My name is José Luiz Passos. I direct the Center for Brazilian Studies at UCLA. I'm also a faculty member in the Spanish and Portuguese department. And on behalf of Cindy Fan, Vice Provost for International Studies and Global Engagement, Chris Erickson, Senior Associate Vice Provost and Director of the International Institute, and Kevin Teresiano, Director of the Latin American Institute, I would like to welcome you to the Center for Brazilian Studies' second to last event for the 2020-2021 calendar year. Brazil, Bolsonaro, and COVID-19 1 year later. The event today is a follow-up on another event we had last year. Our intention is to discuss the current situation and what changed since we met. Brazil continues to be faced with a particularly hard health crisis, and I thank the participants very much today for their willingness to give us an update. So you will find links to our previous event on the Latin American Institute calendar of events and YouTube channel. A recording of other events sponsored by the Center for Brazilian Studies are also available on our website. Over the past 2 years, the Center for Brazilian Studies has co-sponsored over 60 public events in partnerships with 8 different units on campus, in addition to Brazilian universities and the Consulate General of Brazil in Los Angeles. During this calendar year alone, we featured presentations on Black Lives Matter in Brazil, environmental challenges to the Brazilian Amazon, civil registration and human rights, LGBTQ poetry, translation studies, and Afro-Brazilian issues, and the ongoing, now 12-year-old Brazilian film series. The last screening of our Brazilian film series is open, ongoing, and there's going to be a Q&A session or panel tomorrow at 3 p.m. Los Angeles time. And this is a documentary co-directed by Cristiane Torloni on the Amazon. The panel today deserves a special attention given the urgency of the pandemic in Brazil. The event will be moderated by my colleague Bryan, Assistant Director of the Latin American Institute. I'm also very happy to welcome today as co-presenter and discussant my colleague and friend Bonnie Taub, Associate Director of the Latin American Institute, who will give us some context about COVID-19 in the region. I'll be helping out from the backstage, managing the spotlight cameras and gathering your comments and questions. You can use the Q&A function to submit questions and comments. You can submit your questions and comments in Portuguese, Spanish, or English. I hope you enjoy the discussion. Bonnie Taub is a medical anthropologist, associate director of the Latin American Institute, co-chair of the Latin American Studies MA program, and is on the faculty of the Fielding School of Public Health at UCLA. She conducts research and teaches courses about community health, food and culture, immigration, shamanism, and Western medicine, and human rights among peoples in North America, Latin America, and Europe. Professor Taub also collaborates with nonprofit organizations and leads educational and anthropological workshops for clinicians, educators, lawyers, and artists. Welcome, Bonnie, and thank you so much for agreeing to say a few words today.
Thank you so much, José Luis Passos. It's my pleasure to be here. Thank you to our panelists, and thank you to Bryan Pitts as well for helping to put on this program. I'm so pleased to speak with you as Associate Director of the Latin American Institute. I wanted to start by thanking José Luis Passos for all of the time that you have been the director of the Center for Brazilian Studies. In addition to coordinating this program, you have brought so many events as well as scholars to UCLA, and we are very appreciative and grateful for that at the Institute. I wanted to just take a minute because I'm eager to hear from our panelists to talk about the situation of talking about Brazil and coronavirus in Latin America by thinking about the region as a whole. Latin America is an area comprised of 33 nations in Mexico, Central America, South America, and the Caribbean. And it's a place of great contrast, lots of diversity with regards to geography, with regards to different peoples who inhabit the region. From people of African descent, indigenous peoples, European, Asian, and that diversity and those contrasts, I think, are also reflected in the ways that the countries in the Americas have both experienced and responded to the coronavirus pandemic in the last year. And one of the things that's been troubling and alarming has been that so many Latin American countries have remained in the top 10 countries around the world with regards to the numbers, with regards to the numbers of people who've gotten the virus, who've died from the virus. And we'll be hearing more specifics about that tragedy in the Brazilian context. And along with the United States and India and Russia, sadly, the Latin American nations have continued to be in the lead with regards to the number of deaths as well. I have in my mind images of people in Amazonia lined up waiting for the possibility to buy oxygen for their loved ones. So many people dying in indigenous communities due to lack of access to both oxygen as well as care. Images in cities such as Guayaquil in Ecuador of cadavers lined up on the streets due to inability to cope with the numbers of people who have passed away. What comes to mind in the midst of this loss and this death is that people somehow have been able to find a way to continue on amidst the suffering that exists. And the suffering of people in the Americas is not new. The context for looking at coronavirus certainly is in the context of the years of inequalities, and Latin America continues to be the continent with the largest economic disparities between rich and poor, the largest gaps, and also issues related to discrimination and stigma and prejudice continue among various subgroups. So the coronavirus arrives in the midst of these larger issues of what some anthropologists and people in health have called structural violence in the context of the wider political and economic forces, neoliberalism, and also responses of governments, which you'll be hearing about today. But on the ground, I would say that something that I've found encouraging is that in spite of these inequalities, in spite of other diseases and problems that Latin Americans have faced, they have drawn on their resilience and on their ability to move forward. So with that, I will stop and look forward to hearing more specifics from our panelists. And I thank you, Professor Passos.
Thank you, Bonnie. Our next presenter, the first panelist, is Dr. Karin Nielsen, who's professor of pediatrics, specialized in infectious diseases at UCLA. Dr. Nielsen is originally from Brazil and has a long-established collaboration with many Brazilian institutions across the country in the fields of HIV, Zika, and other epidemic infections. She's working on a COVID-19 study in pregnant women with COVID in the US and Brazil, and also in other vulnerable populations. Dr. Nielsen was a former director of the Center for Brazilian Studies. Karin, welcome. You may share, yeah, okay. We can see your PowerPoint now. Karin, I cannot hear you.
Sorry, now you can hear me, right? Sorry, technical glitch here.
Yes, now I can hear you. Yeah, maybe we can give me just 1 second and go ahead.
Okay, so let me share my screen here again. And hopefully you can see my full slides. And let me just swap the slides here. Can everyone see my slides?
Yes.
Okay, So it's my pleasure to be here today talking to the group. This is 1 year after our first presentation when coronavirus was a new virus, a mysterious virus that came from Wuhan, China, and was starting to create havoc across the world. And we've learned a lot during this period, this last 15 months. Just as a background, just to review, the coronavirus we're dealing with, SARS coronavirus 2, is a beta coronavirus. It's in the same lineage as the original SARS coronavirus, which had an epidemic in China and also Canada in 2003, 2004. It's one of the most pathogenic variants, but there are other coronaviruses that have been infecting people. First one was identified in the 1960s. So coronaviruses are not new to humankind. There's also a whole host of coronaviruses that infect animals as well. It's a very transmittable virus, as we've all found. It's transmitted between people in close contact, also via particles. It can be suspended in the air for a little bit and thus infect some people. It has been found on surfaces. It's now sort of controversial whether you can be infected from surfaces or not. Cats and dogs can be infected with coronaviruses, but they really don't seem to transmit with this specific coronavirus, but they don't really seem to transmit the virus. Just a little question about the mask mandates and the fact of social distancing, which we've all become very familiar with in the last year. This is just a study from the US just showing what happened in a community before and after you put a mask mandate. And one of the first things we learned with coronavirus is that if you mask yourself and maintain social distance, your levels of transmission decrease tremendously. So this has scientifically been proven to be very effective. And so these are numbers updated as of last night. We've had 33 million cases in the United States, close to 27 million cases reported in India, and 16 million cases reported in Brazil. However, Brazil is second only to the US in the number of reported deaths due to coronavirus, 450,000. And globally, we've had close to 3.5 million deaths reported due to coronavirus. And this is clearly an underestimate. There are many places in the world where deaths have not been counted and cases have not been reported as well because of lack of testing and so forth. So you could clearly nearly double these numbers minimally. This is, again, a conservative estimate. The bright side in green there is that there have been worldwide almost 1.7 billion doses of vaccines administered. So this is very exciting as we try to end this pandemic. As Professor Taub highlighted, COVID is a disease of significant that underscores all the world we live in and the dramatic racial and ethnic disparities. And this is data from the US that was published in JAMA, but that's true of Brazil as well, and many other places where the virus has thrived because of inequities and lack of access to care in so many populations. So COVID in Brazil, this is a picture of Rio, Christ the Redeemer. And early in the epidemic, as early as April, important journals as The Lancet and also the public media were already reporting that Brazil was being dramatically impacted by COVID. And despite Brazil having a very good public health infrastructure, COVID was really not doing well in terms, Brazilians were not doing well with this epidemic. And there was a disparaged number of deaths and illnesses created by this illness. And this is back in April of last year. And just as Brazil is a country of continental proportions, so when these are the other countries in the world and how they fit in Brazil. So when you're talking about Brazil, you're talking about macro regions and tremendous diversity, geographic, climatic, and so forth, and populational. So this was a piece that we wrote. It's a correspondence that we wrote for Nature Medicine last year, just predicting the number of cases and deaths in Brazil that would be happening if there was not enough social distancing and measures to decrease transmission were undertaken by the federal government. Unfortunately, many of these projections proved to be true. And this is again data from last night. This is a concept of COVID-related mortality. And it's important to emphasize that when you talk about mortality, the denominator is the whole population. And this here is equal for 100,000 people. And as you can see, when you look at mortality at this rate, Brazil tops the list of deaths per 100,000 people. And interestingly, India, which has been facing one of this most calamitous surges, is way in the bottom, potentially because of underreporting of cases. But nevertheless, Brazil, in this graph from Johns Hopkins dashboard, which monitors the pandemic, Brazil has the highest rate of COVID-related mortality. And when you go and look at case fatality is looking at the denominator then becomes people who tested positive for COVID. And Brazil is number 4, but you have here 3 Latin American countries, Mexico at the top of the list, Peru second, and Italy only 3rd as the countries that had the highest case fatality rate. Now, this could be a little bit artificial because if you only test the sickest of the sickest people, of course, you're going to have a higher case fatality rate because those people tend to die. But even so, Brazil is at the top of the list. And then we did an analysis, and this is just looking, and many others have done the same. This is taking data from teleSUR, which is the biggest public health network in the world and has a humongous database, and just looking at repercussions, not only of COVID itself, but the repercussions of preventative efforts. What has happened to that because of COVID. And we've seen that all the monthly medical consultations have declined, dental consultations have declined, home visits by the public health system have declined in 2020 because of COVID. We also saw a dramatic decline in the number of admissions for other causes, as well as a decline in the number of vaccinations given to Brazilians in 2020 because of the pandemic. Because of this, we're also seeing a resurgence of other conditions, a failure of containment of dengue or Zika.
Oh, I think we lost Professor Nielsen here for a little bit. Hopefully her connection will come back soon. The wonders of remote virtual events.
Bryan, should we stop her screen sharing and then allow her to re-enter or resume the slideshow once she's back? I think that's, thank you.
Best way to go. Probably the best way to go about it.
We can wait for her or move on to the next presenter, and then perhaps allow her to resume the screen sharing and the slides at the end. How does the panel feel about it?
Maybe give her 1 minute or 30 seconds and see if she re-enters, and then I would agree if you wish to do that. That sounds fine to me. But...
Sure, good idea, thanks.
Yeah. Indeed, the technology works. It's great when it works and a challenge when it doesn't. Thanks everyone for your patience.
I could tell a quick story here about COVID. We're going to wait a minute. Is that okay?
Of course.
All right.
By all means.
My wife is from, her hometown is called Uberaba, and it's a town run by Bolsonaro supporters. The bakery near her house, one of the workers came in really sick. He told the boss he thought he had COVID. He was trying to put a mask on, and the boss said, no, you can't wear a mask. You have to tough it out. You're going to lose your job if you don't work today. 9 people who worked in that bakery died, including the son of the owner. You know, and that just shows the way that the influence of Bolsonaro and his supporters, it's very similar to Trump and Trump supporters in the US, is really wreaking havoc on Brazilian, you know, society as a whole.
This is very sad, and it's happening in several situations.
Yeah, it's pretty unfortunate. I think that just having you see the difference in having a responsible, even if you have a president who's not that good, at least if he's got some basic responsibility, or she, it can make a big difference in a health crisis, obviously now. Because we're seeing like the difference between Biden and Trump is like night and day in the US. He's not a saint either, but just the fact that he's wearing a mask, he's saying presidential things, you know, people seem to trust him on this. It's having a difference, and we miss having someone like that in charge in Brazil right now. It's horrible.
That's right. Karin's back.
Okay.
I'm sorry, there's something happened to my computer that it just lost its internet. It seems like it got the other internet too, but anyway, I'm just trying to transfer transfer my talk. But if you want to go ahead and give yours, I can always resume mine if you'd like.
Then let's go ahead, and I will introduce the next speaker, and Dr. Karin Nielsen will be back. She's going to have an opportunity to resume the slide show at the end, perhaps after Maria Amelia Veras. Our next speaker, panelist, is Dr. Maria Amelia Veras, professor of epidemiology at the Collective Health Department of Santa Casa Medical School in São Paulo, where she coordinates both the master's and doctoral programs in public health. Dr. Veras has over 25 years of experience in conducting epidemiological studies related to HIV/AIDS in Brazil, especially focused on the LGBT community. She is the leader of a research group called NUDIS, Health, Sexuality, and Human Rights of LGBT+ community. She's currently a site PI in Sao Paulo, Brazil, for 2 large NIH grants. Her research interests include stigma and its role in health inequalities affecting LGBT population in Brazil, barriers to access HIV/AIDS and other sexually transmitted diseases prevention and care. During COVID-19 pandemic, she is also part of the technical advisory group in epidemiology and mathematical modeling. Grupo Técnico de Assessoramento em Epidemiologia e Modelagem Matemática COVID-19 of the Sao Paulo City Health Department. Welcome back, Maria Amelia Veras.
Thank you, José, Luiz. Thank you, everybody, the other panelists, and Bonnie and Bryan. I will share my screen and hope that we can have a nice conversation about it. So I will try to do it briefly, but I thought that after Karin, that will provide all the numbers, I took out the figures from mine, starting from what could have been an advantage to the Brazilian response of COVID-19 or any other emergency in public health. Basically, our healthcare system, the SUS or SUS as we call, is universal, has as its principles the integrality, equity, decentralization, regionalization, and hierarchization. The services must reach everyone according to their needs, regardless of their location. SUS principle also rely on regionalization, but under decentralized in a coordinated manner. This is very important in COVID because we lost exactly the coordinated manner from the central, the federal level, which is the Ministry of Health. SUS has an extensive primary care network of clinics, community health workers. We have and run for many, many years a successful national immunization program that coordinates 38,000 immunization rooms. We have Brazil, and SUS is organized in 450 health regions and 180 macro regions. So we have also vaccine plants, one big plant, public plants I am talking about, one in São Paulo, Instituto Butantan, and the other in Rio de Janeiro, belongs to Fiocruz, called Biomanguinhos. The SUS also has a national surveillance system. So we could expect that with the experience of the system, we could use and take advantage of that structure in our response. But in contrary to that, the response was really disorganized, missed the central coordination that usually belongs to the Ministry of Health, institutionally and constitutionally belongs to the Ministry of Health, who's supposed to issue the guidelines, also guidelines for the state level, for municipal level, and also to provide resources that are not available at those secondary and tertiary level when you are in an emergency in public health. But the response was really centered in providing or increasing the number of hospital beds and ICU, probably very influenced by what was happening in Italy and all the shortage of healthcare system influenced the response in Brazil. And in that manner, for the first period in the year of 2020, the response was in increasing the number of beds and ICU beds. So if we think about the size of Brazil, I think Karin just provided us an overview of how huge is the country. And we see how is the distribution of these resources across the states. It varies a lot. For instance, in this graph, we are showing the proportion of states that have intensive care unit and how they are distributed. So in blue or green, we are seeing the proportion of intensive care units, and in red, those who do not have that resource. That became very crucial in the COVID response as well. So we are facing, of course, even with the response based on providing more beds, increasing the number of beds, creating emergency hospitals, and increasing the number of ICUs, equipments, and etc. The situation of occupancy of those resources, if we can see in this graph, between July of 2020, beginning here, to May 2021, we are going for critical levels of occupancy, meaning that we have more than 80% of the ICU beds occupied. And you may know that in several moments, we reached more than 100%, not only in the Amazon state, in the city of Manaus, but in several other parts of Brazil, including several regions of the state of São Paulo, which is the richest state in the country. So here we have the current trends in hospitalization in the health districts of the state of São Paulo, to provide you an idea how this situation is really different and behaves differently in different health regions within one single state. So we have a state where you have regions, the regions are big. The state of São Paulo has almost 600 municipalities, and it's divided in 17 different health regions. And the curves are showing in some regions we went down with the gates, but in the past few weeks, all of them showing trends of increasing again. So I don't expect you to see the numbers, but this is the level of occupancy rate by health regional district in São Paulo state. And all that comes in pink, red is more than 80% of occupancy. This is for the current month. So the situation is still very, very critical. We also saw the shortage of oxygen, we've been experiencing shortage of intensive care physicians, of other supplies during the whole time the epidemics among us. The second thing that we had a potential strength for our response is our primary care network, our primary care units. And I'll show you briefly the response of 1,000 municipalities and federal districts regarding how was the response of this level of attendance, the primary care level, during COVID. So basically, the researchers show there is the lack of oximeter, thermometer, oxygen, access to tests. This is critical for Brazil from the beginning of the epidemic. I'll show you some data on that. Difficulty referring critical patients, a lack of internet. The healthcare workers have to rely on their own cell phones to make some communications. Lack of definition for the role of community health workers. Impact on continuity of care, especially for chronic disease. Karin was mentioning that as well. So we did have an impact in other actions and health care for chronic and for antenatal care, for attending to deliveries. Everything is compromised by what we did not respond to COVID. So we did not only did not respond adequately to COVID, but we compromised everything else that was working well in the country. Oh, I'm sorry. Oh, this is that test and positivity test is key. It's a key step in all the response to COVID, and as well as in the evaluation of monitoring and evaluation of the implementation of the measures. In the red line is the level that WHO recommends to release, for instance, social distance measurements, and this is the situation of Brazil. So when we have, I'm sorry, it was in the wrong direction. When we have most of the tests and tests with high rates of positivity, it says we are not testing enough. We are testing only people with symptomatics and probably severely ill with COVID. Most of the tests, the RT-PCR tests, were done in the context of hospitals. We haven't used RT-PCR to do surveillance, to do tracking contacts, what we should have done all the time, and it was never a reality in Brazil. Another data here is a comparison in the positive rate tests comparing to COVID deaths, and we can see here Brazil in red. Our deaths, our positive rates of tests is very high. So clearly affirming that we are not controlling the disease. During the whole year, there is a disconnection between the level of the epidemic and the increasing or enforcing measures of control. Here we have two works showing this. This is work from Andresa Santos. For instance, Rio Grande do Sul, in red, there is no measure, no lockdown, no social distance implementation, and in dot is oxygen, the oxygen, oxygen supply low. So even we did not have oxygen supply enough to attend the needs, the state in this case did not implement any measures. In general, we see here, this is a curve showing that during the beginning of the 2020, we increased the number of cases, and the measures of social distance were concentrated at the beginning, and never more there were any consonance between the requirement of the epidemic, the increasing number of cases, and the implementation of the measures. This is another example in Florianópolis in the south of Brazil. So researchers is examining the level of increasing the level of epidemic by RT, the reproductive number increasing greater than 1, and the measures that were releasing the implementation of any obligation of social distance, obligation of facial masks, etc. So the dot lines are all measures that were taken in dissonance with the curve of the epidemic. And this is, we see this up to today. And last, our last resource that would be vaccine. So this is the number of doses by date of vaccination. This is the data that the Minister of Health is releasing. As we can see, it's a fluctuation based on the availability of immunization, of vaccines in the country. We had a lot of problems with supply, especially during the end of April and May. Basically, we could not provide any more Coronavac that is produced in Brazil by Butantan Institute, or AstraZeneca that is produced in Rio by Biomanguinhos Fiocruz, because the ingredient IFA, the active ingredient, comes from China. It did not arrive as expected. Here we have vaccine coverage by state and number of doses. In blue, 1 dose, and in yellow or orange, a second dose. So we see that the most, we reached 60% of the target population in few states, but the second dose is still very low for the country as a whole. Here is by age group, and we can see here probably the healthcare workers concentrating highest coverage in the age group of 45 to 49 years old. But even for the ones who are prioritized in Brazilian campaign, in Brazilian vaccination, elderly and healthcare workers, we don't have a lot of them vaccinated, with fully vaccinated up to now. So this is the composition of vaccine available for the country. In red, we have Coronavac, which is the Chinese vaccine produced by Butantan Institute in Brazil. In blue, the AstraZeneca, produced by Fiocruz. And here in yellow, the Pfizer one. So basically, we rely on the Coronavac vaccine. It is produced in Brazil. It's safe. It's an attenuated virus vaccine, but its efficacy and effectiveness is lower. The efficacy on phase 3 show only 50% of efficacy for this vaccine. And the preliminary data of effectiveness, when the vaccine is applied in the real world out of the context of clinical trials, is still lower. So with this picture, we see that we have a big challenge ahead of us, and we still miss a lot of coordination in all these actions. So in conclusion, I would like to say that if the healthcare system did not respond as we expected, in contrary, I think the scientific world and the society is mobilizing a lot of efforts in voluntary and spontaneous network creation that is absolutely amazing and incredible. In pink here, the technical notes are from a female scientist network that comprised more than 3,000 scientists who are women, and it was grouped in less than 2 weeks. It's absolutely amazing, and the group is working every day and issuing technical notes and advising and occupying all the spaces possible to dispute the narrative of negationism and lack of coordination coming from our government, especially at the federal level. So thank you. I hope we have time for some questions and discussions about this.
Thank you, Dr. Maria Veras. If you can stop your screen sharing,
Yes,
we can perhaps move on to or resume Dr. Karin Nielsen's presentation. Karin, are you ready to resume your slideshow?
Yeah, I can resume for sure. Let me just go back.
Perfect.
To the
And
screen.
in the meantime, I'd like to remind you all, panelists and attendees, that you can submit your questions using the Q&A function of our Zoom webinar. Please send your questions, and Bryan, Pitts, and I will share them with our panelists.
So can everyone see my screen?
Yes.
Yes, Karin.
And you can hear me. Sorry, I really apologize. As you can see, internet difficulties are not only in Brazil. My internet just died unexpectedly. So I was just talking about COVID and pregnancy, which has been a focus of my career personally. I've done a lot of research in COVID and pregnancy and manifestations of diseases in pregnant women and their babies and how that repercusses. So COVID-19 is a disease that carries a potential for adverse events to women when they are pregnant. They have a higher rate of complications, and the babies, even though it's not a virus like Zika that causes teratogenic disease, causes malformations in the babies, COVID can cause a lot of prematurity, and there's concern that all the immune activation that women with severe disease have during pregnancy, that could lead to behavioral developmental problems in the babies later. So this is an area that we've been looking at, and this is a report of the almost first 1,000 women who were pregnant in Brazil who had COVID, and a very high number of deaths, actually was over 10%. And in the first 2 months of the epidemic, this actually was already 10% of the annual maternal death rate for the whole country. So COVID has had tremendous repercussions for pregnant women. And of course, when you have surges, a lot of people get infected. And this was something that came out in Globo back in early April, talking about how many pregnant women were being intubated and taken to the ICUs. And this had led to an unprecedented rise in maternal mortality in Brazil because of COVID-19. And in the US, the CDC has now recommended vaccination of all pregnant women, as they are a very high risk group for having untoward events if they acquire COVID during pregnancy. But in Brazil, the recommendations were slower to happen, and there have been issues now with the AstraZeneca vaccine not being recommended to pregnant women, and there's only then the Coronavac, which is the inactivated Chinese vaccine. So there are still a lot of issues related to COVID in pregnancy as well. We are actually doing a study looking at this in Los Angeles and in Rio. And this is based on a lot of work that was undertaken for Zika. It's a similar kind of study. But I just wanted to talk just a little bit about the variants, and we all hear about the variants, and that's why we're also worried about COVID, in that you have, these different variants that arose in England, B117, and then arose in South Africa, B1351, and more recently the P1 lineage of virus in Brazil that arose in Manaus, and the concerns that these variants can predispose people to have more resistant COVID. There's no data to show that these viruses are more lethal to people, but what happens is they're far more contagious. The virus has evolved. Whenever you have a surge that is not controlled and you have a lot of viral replication, as the virus multiplies, it undergoes mutations. It has these changes, and then the mutations that are most beneficial to the virus start to predominate predominate in the viral population. So the virus is not necessarily, these new variants are not necessarily more lethal, but because they're 50%, 60% more contagious, you have more people becoming sick. And so you're seeing more complications, not because the virus is more virulent, but just because many more people are acquiring the virus. So that's been one of the major concerns. And because of the high unprecedented transmission with these new variant strains, we've seen COVID disease mortality and morbidity in much younger age groups and young people, including children and adolescents, because of the very high rate of transmission. And we did a study with Fiocruz recently looking at transmission in this slum in Manguinhos, which surrounds Fiocruz. And we actually did see that children under 1 year of age were more likely to have symptoms and more likely to potentially be hospitalized. And this has actually been reported in some media from Brazil, showing that, we think of COVID as a disease that is causing, death in older people or people with underlying conditions, but actually because of a very large number of cases, we also see children being affected. And, this has drawn critique from a number of societies. This is just an example, and this is back in June of last year. This is the Brazilian Society of Infectious Diseases, complaining about the lack of transparency of the Ministry of Health in divulging data and in death rates in the country. And then, of course, we've all seen the press about how Brazil has been negatively impacted and millions are going hungry as the virus rips through the country. This is from the New York Times. And then, of course, we all know that, and I think the next speaker will address this, but there's been a congressional hearing of potential mismanagement of the pandemic in Brazil. Dr. Veras already talked about the vaccines, but these are the 3 vaccines highlighted here available in Brazil. And of course, the vaccines are really how this pandemic will end. We've seen this in the United States and countries that have been immunizing successfully. Brazil has been slow to implement the vaccines. There's a shortage of vaccine product. The Pfizer vaccine was not purchased early enough. And this is just an example. This is actually my daughter-in-law who lives in Brazil sent this to me. I mean, unless you have a comorbidity and you are 38 or 40 years old, or you happen to have, be a healthcare worker, you really can't be immunized. As it is in Rio right now, the immunization threshold is 60 years of age, unless you have a comorbidity, and they're going to start immunizing 59 and 58, 57-year-olds without comorbidities in the next couple of weeks. So it's been a very slow response. And this is just a graph comparing Brazil, which is here on the 4th in the line, as to other countries in terms of immunizations. And there's this app, our Walden Data, which actually shows you how many vaccine doses have been reported worldwide. You have to remember that most of the vaccines, certainly the ones given in Brazil, there are 2 doses. So you have to divide this by half, and you take into consideration the population of the country. So if you look at this data from yesterday in Brazil, where you have close to 58 million doses given, that is about 29 fully immunized individuals, which would give you a coverage rate of 14% if you consider the whole population of Brazil, granted that individuals under 18 are not eligible for the vaccines in Brazil yet. In the US, that would give us a number of around 43%. In the UK, about 46% overall coverage with 2 doses. And just to finalize, this is just data demonstrating, this here is Brazil, the average 7 daily average of cases, we're about 62,000 cases average in this last week, as compared to the US, we had 21,000 cases in the last week of COVID. And in terms of deaths, Brazil has had a 7-day average of 2,004 deaths across the country as compared to 578 in the US. There's a lot of progress to be done in both countries, actually, but Brazil is not in a good position. And this is the 7-day average and how many vaccine doses have been provided in the US on the top and in Brazil at the bottom. And this is the number of doses that have been given, 2 million. Over 2 million has been the average in the US and Brazil, about 662,000 doses. So pandemics are not permanent. I do believe that we are approaching the end of the tunnel, even though vaccination has been slow and there have been a lot of issues. I do believe that even with a vaccine that's 50% effective, as Dr. Veras was saying, CoronaVac, we have achieved less transmission in adults and the elderly, and we're hopefully going to move forward to less and less people infected. But this needs to move at a faster pace for us to be able to end the pandemic in Latin America overall and globally. So this is my colleague hugging Rio, and I think I'd like to end my presentation here. And I'm sorry about the technical problems.
Thank you, Karin. Thank you so much. That's such a thorough, critical update. We have a third presenter. We're saving the questions for last. I will invite the panelists to take a look at the Q&A box. We already have two questions in, and I'd like to remind the attendees that they can submit their questions in writing using the same function, the Q&A function. Our next presenter is Bryan Mier, who is co-editor of Brazil Wire, Brazil correspondent for teleSUR, the English news program from the South, international relations coordinator of the Brazilian news channel Brasil 247, Brazil 247, and editor of the book Ear of Lead. Is it Ear of Lead or Ear of Lead? Washington, Wall Street, and Lead. Yeah. Right. Washington, Wall Street, and the New Imperialism in Brazil, published in 2019. He has master's degrees in human geography and sociology and has been living in Brazil for over 25 years. Welcome back, Bryan, and thank you for participating again in this.
Thanks, Jose Luis. Thanks to all the other panelists in the audience. I know we're kind of strapped for time here, so I'll try and make this quick. What I'd like to do is just kind of add political context to all of this. I think that it's great to hear all of the numbers and things like that, but you begin to wonder, like, why is Brazil so bad? Why has Brazil been so bad in its response to COVID? You know, and you could say the same thing about the United States. I mean, you compare the United States to like Vietnam or something. The United States' initial response to COVID was horrible. The difference is that the United States is now leading in vaccine administration, and Brazil's vaccine administration is also bad, just as its initial response was also bad. And one of the reasons for this, which is coming out more and more, in part due to the ongoing Senate investigation into improprieties and mismanagement of the COVID crisis and the information that's coming out, is that it's appearing that the Bolsonaro administration deliberately sabotaged the COVID-19 response. You know, and so I'm going to start with a few points. I think I can try and put a few things on the screen. But first of all, there's some misconceptions about Brazil. You know, a lot of times people in the North just assume that every country in the South is poor. It's all the same thing. I know that I'm simplifying here, but it's important to remember that Brazil is an upper middle income country. It's not broke. During the PT years, the Lula and Dilma Rousseff administrations built the foreign reserves up from 49 billion to around $360 billion. Foreign reserves are still over $300 billion. There's around 180 to $200 billion in national reserves. Brazil is the third largest lender nation to the United States after China and Saudi Arabia. The US owes Brazil $240 billion with interest, and the IMF owes Brazil around $40 billion with interest. It's not a question of lack of money or funding that has caused this crisis. The health system in Brazil has been sabotaged, starting with the constitutional amendment that was passed after the 2016 parliamentary coup against Dilma Rousseff, in which they froze all public health spending for a period of 20 years, not even allowing increase in spending comparable to population increase. This kind of incapacitated the government's ability to respond to an emergency like this. Then when Jair Bolsonaro was elected, for ideological reasons, one of the first things he did was he kicked almost 9,000 doctors out of the country who'd been working in the favelas and in the poor rural areas where Brazilian doctors didn't want to work. There's no shortage of doctors in Brazil, but the studies showed that they kind of cluster in the major cities because they want to live a good life in a big city. And so, and they were kicked out. Why? Because they were Cuban, okay? Subsequently, now they've started trying to invite Cuban doctors back. Then we know that John McAvoy, a journalist from the Cannery in England, through Freedom of Information Act documentation that he received from the British government, shows that Bolsonaro and his sons were meeting with representatives from AstraZeneca before the election in meetings that were held secret meetings. They weren't publicized, and they were brokered by the British government. And it now looks like there was some kind of favoritism shown towards AstraZeneca over CoronaVac at the beginning of the vaccine rollouts. We now know also through documents that were published by the United States Health Department that the Trump administration sent an envoy down to Brazil last October to try to talk the Bolsonaro administration out of purchasing Sputnik 5 vaccine. Okay. In addition to that, we have a video that came out about a year ago in which an advisor, there was a meeting with Bolsonaro and his cabinet, an advisor to his finance minister, Paulo was explaining how much money they would save if more old people died from COVID. And so now the MST has calculated, the Landless Rural Workers Movement has calculated that due to the deaths of senior citizens that appear to have been at least not prevented, but maybe actively encouraged by the mismanagement of this whole crisis, the Brazilian federal government's now saving around 121 million reais a month in pension funds. Okay. We know that the Trump administration dumped chloroquine on Bolsonaro after the FDA banned it for treating COVID-19. And we have now a year and a half of scandal after scandal. The government tried to create a phone app so that people could get chloroquine if they felt like they had COVID and start taking it early. That was blocked, and his first two health ministers resigned because they refused to recommend chloroquine for COVID-19. Bolsonaro is now the last world leader that I know of at least, who's still recommending, he's still lying to people and saying that hydrochloroquine cures COVID-19, that you don't have to worry about masks. If you catch it, all you have to do is treat it early and you'll be cured. And in addition, and we see that there, through the Senate investigation that's going on right now, that there's all kinds of like licitation violations and no bid contracting that's been going out to producers of chloroquine. The largest chloroquine producer in Brazil is a political crony of Bolsonaro. And so that it looks like that out of personal self-interest and opportunism, they've been pushing this ineffective drug that's and telling people to relax and not worry about COVID, and it's created the result is hundreds of thousands of deaths. In addition to the vaccine attempts by state governments and things like that, and field crews being constantly sabotaged. Like the same week that they started rolling out the vaccines in Sao Paulo, Bolsonaro went on a live on Facebook and warned women that it could make them grow beards if they take the China vaccine, which is the CoronaVac vaccine, and things like that. Okay, but I'm going to give one, I know I don't have that much time, but I want to give one example of how political opportunism led to more deaths in Brazil and around the world, really, because is this on the screen? Okay, so the second to last health minister of Jair Bolsonaro is a military general with no public health experience and very little logistical experience, named General Eduardo Pazuello, who'd been presented as a kind of like bumbling Homer Simpson kind of funny character. He wasn't very good at what he was doing. He didn't really have the facts and figures about COVID. He had to go just because he was incompetent. But during the CPI investigation, the senatorial investigation now, it's come out that he's actually from a political family in Manaus. Up here, you can see up on the map. This is a close-up of the border between Rondônia and Amazonas states. And you can see at the bottom, there's a city called Porto Velho, and at the top, there's Manaus, top left, right? So it turns out he's a multimillionaire from a political family in Manaus. His brother was accused of operating death squads and human trafficking about 15 years ago, and is still a very powerful political figure in the Manaus region. And in the investigation, it came out that General Pazuello has millions of dollars invested jointly with his brother in operations in the Amazonas area that are involved with illegal deforestation. Okay, so when the Manaus oxygen crisis began, the first thing that the Bolsonaro government did was they blocked flights coming in from Venezuela because Maduro was trying to send oxygen to Manaus. They ended up sending it by caravan and trucks anyway. And they knew the crisis was coming. They refused to send airplanes with oxygen to Manaus. General Pazuello chose instead to bring oxygen in by truck on this Highway 319. Now, this Highway 319, which you see the red arrow on the map, this is a very political thing because it's not paved. And you see the areas to the right where the green tone is lighter. This is an area called the Arc of Fires in the southern Amazon rainforest, where illegal loggers and ranchers are invading indigenous reservations, burning, cutting down trees, poisoning the rivers with mercury and mining. And the only thing, according to most environmentalists, that is preserving the rainforest in this area is the fact that this highway is not paved, because it's closed during rainy season. It's not easy for soy farmers on the international value chain supplying soy to companies like Cargill to be able to farm their products illegally because they don't have good road access. And so when the oxygen crisis started and all those people were suffocating to death in Manaus, Pazuello and the Brazilian Health Department started showing pictures of trucks carrying oxygen bogged down in the mud on Highway 319 to politicize the issue, to say, look, the reason that all these people are dying in Manaus is because we have to pave this highway. When they knew it was rainy season, they knew the highway was closed off, they just wasted a bunch of oxygen and deliberately let people die to push their political objective. And this is just like one of dozens of examples of how opportunism and backstabbing among a bunch of greedy people connected to the Bolsonaro administration has also further exacerbated the COVID-19 crisis here. And so what I'm just going to leave this with, we're kind of in like a worst case scenario in Brazil right now, in that Bolsonaro copied his idol Donald Trump's initial response to COVID. He copied his telling people not to worry about it, it's just a little cold, take chloroquine and this and that. But we never had a Biden come in to roll out the vaccine. So we still have a president who last weekend was in a major event with no mask on, with a bunch of people with no masks on, copying basically one of Benito Mussolini's famous motorcycle rides of the 1930s, to build up support from his fascist supporters. So even though the crisis is fading around the world, even though the deaths per day has dropped to, only 2,000 a day in Brazil, which is still double of what it was like in the worst time last year, I think Brazil still has a long way to go to get out of this crisis. And that's my speech for today. I don't know how to get the share screen back off. But that's all I have to say for now.
Thank you, Bryan. I will try.
Wait a second. I think I can do it here. I think. Let's see. Where am I?
I think
okay.
I did it.
All right.
For you.
Cool.
Okay.
Thanks.
Bryan did it. Thank you so much for again such an eloquent and as always thought-provoking participation. And we have crossed the 1 hour time mark for the event. We're now open for questions. We already have 3 questions. I would invite the panelists to take a look at the Q&A inbox, and I'll move on now to Bryan Pitts. Bryan Pitts is my colleague in the Latin American Institute. He's assistant director of the Latin American Institute and has been an immense source of support for the Center for Brazilian Studies in particular, helping me not only to conceive but to execute and produce many events, including this one, the original one year ago, and this one. So welcome back again, Bryan. Thank you so much for your support and participation, and I'll let you now lead the moderation part of the meeting today, and then direct the questions from the audience and the attendees to the panelists.
Obrigado, José. All right, well, I guess since we are already an hour over, and sometimes with these virtual events, people start to go away at some point because we all get zoomed out. I'll go straight to some of the questions from some of the members of the audience. Question from Diana Blanco. And this was really, I think, addressed really to all the panelists. in the US, as in Latin America, there's a growing number of anti-vaccination misinformation going around, especially on social media and communication methods like WhatsApp. So do we have any ideas what percentage of the Brazilian population is vaccine hesitant? And are there any measures in place, perhaps at the state level, because I'm sure they're not in place at the federal level, to reduce misinformation?
I can tell something about it. The level of vaccine hesitancy was never high in Brazil as in the US. A couple of months ago, we had a national poll that showed 15% of people saying that they would not have a vaccine. And recently in the state of São Paulo, it's more than 90% would accept vaccine. So although all misinformation and fake news promoted by supporters of the president, I think that the Brazilian population still believes in vaccine and will be vaccinated once the vaccine is available for them.
Did anybody else want to jump in with anything related? I think it was a pretty thorough answer that covered the question pretty well, but did anyone else want to add?
I agree with Dr. Veras, and I think that vaccine hesitancy actually can be overcome with information. And so, you know, and we see this in the US, but once you inform people and discuss cases with them, it's a minority that really absolutely want no vaccines at all. You can still educate the population and, you know, make it work.
I'll just add, a recent poll showed that 14% of the Brazilian adult population are the core fanatical Bolsonaro supporters who believe everything he says. And he's spreading vaccine misinformation. And that's a roughly correspondent with the figure that was just given out for who is vaccine hesitant in Brazil. So I'm not saying there's a direct correlation there, but it's just interesting that it's the same number basically.
You see the same pattern with Republicans here who are hardcore in the United States, kind of similar.
Okay, our next question is from Ramya Reddy and is directed specifically at Dr. Nielsen and asks if there's evidence for teratogenicity of COVID infection, similar to the Zika virus. And I don't know what that means, but I'm sure you do.
Teratogenic means a virus that can cause malformations in the child. So no, SARS coronavirus is not shown to be teratogenic, and transmission from mother to child of the virus in the case of COVID is very, very low. It's thought to be less than 1%, meaning that the virus would cross the placenta and infect the baby. Most of the cases of infected newborns they've actually been infected because of exposure to secretions of either the mother or adults around them who had COVID. Having said that, SARS coronavirus 2 in women who have severe illness leads to premature delivery. So we've been seeing a lot of babies that have preterm deliveries, a higher number than what would be expected. And there is an indirect mechanism thought that might influence neurodevelopment in which women who have very severe disease during pregnancy and have a lot of inflammation, that, you know, this inflammation in the mother could adversely affect the infant in the future in terms of neurodevelopment, autism, or, you know, psychiatric illness. But this is a theory. It hasn't been proven yet, but there's concern about this. And this has to do more with immune activation and inflammation, but not teratogenicity.
Great, thank you. So I'm going to go to a question from Roberto Schonman. And this is a question I think that could be addressed to all the panelists. If the US and other countries would like to help with the COVID situation in Brazil, what would the members of the panel recommend as the most effective kinds of assistance that can be offered?
I think vaccines would be the first and foremost, in my opinion. If Brazil could, you know, have access to especially messenger RNA vaccines such as Pfizer or Corona, Moderna, I mean, that would be ideal because these are the vaccines that work the best. And I think we have to make vaccines available for Brazil as early as possible, because that's really the leading way to end the pandemic. Is this sooner the better. So if making vaccines available, that would be ideal in my mind.
Yeah, I agree. I agree, Karin. I think that vaccines are a crucial issue in controlling the disease in Brazil right now.
Here's
I
a
would
question.
I would just say, yeah, that and pressure your local congressional representative to put pressure on Biden to cut relationships with the Bolsonaro administration, because he's kind of like going either way on this issue still. There's a lot of pressure from the ground up. But as long as we have a president who's telling people not to take the vaccine, it's hard to get, full vaccination. So, but obviously the emergency thing right now is more vaccines. That's the most important thing right now.
So our next question is from Ramya Reddy, and it's actually something along the lines of a question that I had as well, particularly for Bryan, but really for all the panelists. Bolsonaro was elected with the support of the educated and middle class. Is that support still there in light of recent events? And what are the implications of this for the upcoming election in 2022?
His support among the educated elites, the upper middle class, has dropped a lot. That he's pretty much lost them at this point. There's a percentage that still support him, but like some of the big center-right political parties have now openly broke from him. So if there were an election held today, Lula would have a good chance of winning in the first round. The situation in a free and fair election does not look good for Bolsonaro, and the tendency is his supporters could continue to drop because more and more of his followers are losing relatives now to COVID. Like you can't uphold that lie forever. And he also promised all of his followers that Trump was going to stay in office, that the election was stolen. So people who used to believe in everything he said are kind of like falling off. People are beginning to like lose enthusiasm for him, even if they're conservatives. And I think the business community is realizing how bad for business his disastrous, what some people call genocidal COVID policies have been for Brazil. And also the idea of transforming Brazil into this pariah state, cutting ties with its most important trade partners. So I think all around, he's losing support from all of his support groups.
Anybody else have anything to add to that?
No, I agree. I agree with Bryan. I think that there is a lot of dropout in terms of support. He still managed to have some followers who are completely out of the mind, in my opinion. But in terms of general population, it dropped a lot. I think that's very important that the Bolsonaro government faces international pressure in several issues, not only in COVID, but especially also the environment protection, which is being severely destroyed in Brazil under Bolsonaro. He accelerated several measures and dismantle of the surveillance, the protection, the programs that could protect the environment. And this is also a very key and delicate issue for international pressure that will help for sure to decrease his popularity.
I agree with everything that's been said, so nothing to add. I agree with both panelists.
I actually had a question that I wanted to direct to the panelists as well, because I think one of the really defining phenomenon of the pandemic, at least from a political standpoint in the US, has been the way that people's attitude towards science and public health and the pandemic are linked to political positions, right? If you're on the left, you kind of respond to a lockdown one way. If you're on the right, you respond to it another way. And I'm wondering if Brazil has sort of this I know as recently as March, during the latest wave, many states imposed lockdowns, including Sao Paulo. Did you have in Brazil the same sorts of this is my freedom, how dare you tell me I have to wear a mask or stay indoors sort of thing? Or did that take on a different hue, and the resistance to lockdowns take on a different hue in Brazil from in the US?
I guess I could answer this first because I live in a neighborhood on the periphery of Sao Paulo where a lot of people were walking around without masks, and it really helped that the late mayor Bruno Covet gave an order requiring everyone to wear a mask on public transportation early on. because it caused people in my neighborhood to start walking out of the house with their masks, at least. Even if they're wearing them on their chin, they'd put them on at the bus stops and things like that. And it helped get people wearing more masks. I think that the core fanatics, this 14% who believe in everything Bolsonaro says, they could be compared to like flat earthers or QAnon in the US. And they believe in this freedom, that these conspiracy theories that have been spread around, like the Great Reset or whatever, about how masks are trying to take your freedom. But a lot of people just kind of like, to me, seemed like they took a kind of fatalistic attitude towards the pandemic. You know, like if you're poor, you live on the periphery of a big Brazilian city, you know, you probably have relatives who've been killed by the police. You've got relatives who've died of preventable illnesses probably over the years. And I think some people were just like, you know, maybe it's important. Maybe this is just something rich people do. Maybe I don't need a mask, but it wasn't such of a hardcore like thing that you see in the US with Republican Trump followers and things like that. That's just a personal observation. That's not very systematic. I'm sure the two doctors on the panel might have better information on this.
I agree with you, and I think that it's not that is an exact correlation between Bolsonaro supporters and not adopting the recommended measures. First of all, I think that we need to realize that there is a vast majority of population that is no support, no economical support, no living conditions that allows them to follow strict measures of social distance or having, well, facial masks is something that is less complicated to be implemented, and now we have more, including the N95. But at the beginning of the epidemic, it was not an item that could be affordable for those who don't have money to eat every day. So this is a very complicated issue. I would say that even middle class are tired of being with no schools, locked at home in Zoom meetings and etc. So the whole atmosphere in terms of implementing and keeping social distance measures in Brazil that are required for the level of epidemic we still have ongoing, it's very low right now. I would say that if you travel from São Paulo, you see neighborhoods in which everyone is wearing masks and following some restrictions, and neighborhoods in which you think that pandemic's over forever.
Yeah, I would add that I don't think it's been politically motivated either. In all the videos I've seen of Baixo Leblon, Baixo Gávea, you know, in recent months when restaurants were open, you know, there's such a conglomeration of people. The beaches in Rio, unless they're closed by the mayor, you know, they're packed and people are elbow to elbow on the weekends. I think there's also a lack of population response to some of these measures, you know, I mean, and I don't think it's driven by politics.
But there was no political communication enforcement, clear, never in the pandemic in Brazil. This is a battle from scientists to politicians to business people. It's very complicated.
Yeah, I think it's fueled by mixed messages. You know, someone says something, another says something. There was never a uniform sound message coming from everyone with very different policies all over, very similar to what happened in the United States, as a matter of fact.
Thank you, everyone. I have a very, very practical question from Walter Colton, who is asking, so if people here in the US have been vaccinated with Pfizer or Moderna and traveled to Brazil, should we feel safe doing so? Is it safe for a person from the US who's been vaccinated to travel to Brazil, or is there any indication that Brazilian variants could overcome the vaccines that we have, the main ones we have here, Pfizer, Moderna, and Johnson & Johnson?
I got a question like this just recently as well from a family member. The vaccines in the US, you know, the Moderna and the Pfizer vaccines are 95%, 94% efficacious. So there's no evidence that the strains in Brazil are, you know, will not respond. The immunity that you have with these vaccines will not protect you against the Brazilian strains. However, having said that, 95% is not 100%, right? So there could be failures in some situations. So it's a matter of risk-benefit analysis. I think as more people in Brazil are immunized, there will be less of a chance to test how good your vaccine took, so to speak. Conversely, something that has not been mentioned, we still cannot accept in the United States, there's a mandate for Brazilians not to come to the United States. So unless they have a green card or they have dual citizenship, for the most part, Brazilians and Europeans from Schengen countries can also not come to the United States, as well as people from India, China, or Iran. So while Americans can travel to Brazil, unfortunately, Brazilians still cannot travel because of the concerns about the variants and the epidemic.
Can't hear you, Bryan. You're mute.
So I also wanted to, I finally figured that out. You'd think I'd figure out how to unmute myself after a year of webinars. Also just want to say too, if Professor Passos and Dr. Taub want to jump in at any time with questions, you're certainly welcome to do so as well. I do have one more question from Ramya, who is asking us, said in the beginning of the pandemic, there were pop-up tents and campaign hospitals set up with some structure to unload some of the burden from the hospitals and ICUs. Was that effective, and is it something that's still happening, or is it an option that is it an option moving forward?
Most of them are not in place anymore. So somehow the healthcare system managed to open new beds and close the new ones. So it's an ongoing balance. It's difficult to calculate nowadays hospital occupancy rates because the number of beds can be created, and some hospitals just transform everything that they have in COVID beds as the cases increase. But they were helpful, and I think that they really helped to contain and to avoid, for instance, in the state of São Paulo, we never faced a shortage of hospital beds, for instance.
What I noticed is that it seems like the timing was kind of wrong. Like they put a lot of places put up all of these MASH units too early. And then people started complaining, oh, look at all this money they spent on this. They're not even being used. And some mayors and governors started taking them down. And then when the second wave hit, they were unprepared. And so there was a short, in many states across Brazil, the hospital systems, the ICU unit systems collapsed because they'd, taken down a lot of the MASH units.
One issue that needs to be said is that you can quickly have an hospital bed and even respirators and other equipments, but it's not easy to prepare a team able to manage a COVID case that is complicated. So also this is something that we need to keep in mind, that we've been telling in Brazil, it's not enough to prepare the hospital beds and ICUs. Of course, we need those, but we need to prevent cases before, so we can manage those cases that will really need hospitalization and ventilation and everything else. But since we don't do the homework, we don't test, we don't identify those with minor symptoms, we don't do contact tracing, we focused our response only in hospital beds. And this is being shown that's not effective. And the whole year we've been discussing all these issues. Bolsonaro teams also, they provided a lot of fake news regarding these hospitals, saying that they were ineffective, that they were with not occupied as the level that mayors and governors were reporting. So it's a lot of controversial issues, and I agree with Bryan. They were not open in the right moment and closed in the right moment. That's right.
Yeah, I would just add that the timing also of many things. I mean, there was a lot of push, like very early on in the epidemic, the pandemic in Brazil, there was a lot of lockdown and so forth, which generated lockdown fatigue. And then when the number of cases escalated dramatically, then people didn't want to be locked down anymore. And that's when it was most needed. So there was a dyssynchrony in a lot of the initiatives early on, and that, you know, persisted throughout the pandemic.
Thank you. We're getting close to 1:30 local time here in Los Angeles, which was our target for the webinar today. Are there any final remarks on the part of the panelists? Any final words of advice or wisdom about the situation? I hope the attendees benefited as much as I have. It's been extremely insightful and interesting. So I'd like to take this opportunity to thank all of you, Dr. Karin Nielsen, Dr. Maria Veras, Bryan Mier. Also, thank you, my colleague and friend Bonnie Taub, for the introductory remarks. Thank you, Bryan, for helping us with the Q&A session. Thank you, Ari Barrera, for the logistical support in the background. I'm gonna leave for all of you here a link to our event tomorrow, and that is the final screening of the Brazilian film series. The film is already available for you to watch until tomorrow. And then tomorrow at 3 p.m. local time, we're gonna have a Q&A session with the co-directors, Cristiane Torloni and Miguel Prevadovsky. And the film is Amazonia, the Awakening of Florestania, since environmental issues have been a part of our programming and was mentioned also today by one of the panelists. I thought you would like the documentary is fascinating. It's highly political. It's worth watching. I strongly recommend it. So if you are free, please join us tomorrow at 3 p.m. Thank you very much. Again, Bryan, Maria, Karin, Bryan, Bonnie, and Ari. And I hope all of you are healthy and safe, and your family and friends as well. Thank you all, the attendees and the audience for participating and sending in your questions. And I wish you all a wonderful rest of the week.